Yeah, so again, this is a patient who has lived her life with stage 4 breast cancer for a little over 2 years. She's starting to become symptomatic and the more symptomatic, and then her bony pain's more persistent. And you're starting to become more worried because the lesions that you know can really impact her quality of life is these lung lesions that are now quite sizable. They're obvious on CT scan. A couple of them are measuring close to 4 to 5 centimeters. So you're a little bit more worried. She's a little bit more symptomatic. And the decision-making point at this point is, do you try to milk out a little bit more benefit from an anti-estrogen agent, or do you switch to chemotherapy? And at least in my practice, I would start with something very kind and gentle like capecitabine as a single agent. It's also an ideal time to, when you're making those decisions, which is a big difference from going from a pill or a shot to oral chemotherapeutic agent. Those are worlds apart in my mind, and so you have to sit down and kind of carefully discuss this with the patient. It's also a good time to think about clinical trials, and at least in my practice, I would be thinking about maybe a repeat biopsy, in part to repeat the ER status, because we know that ER loss can lead to anti-estrogen therapy resistance, and also to think about, some of the genomic predictor models that could help us look for things like estrogen receptor mutations, PI3 kinase mutations. So this is a kind of a real meaningful point for this patient because you're making a decision to start going down the chemotherapy pathway or the anti-estrogen pathway.